As Austin manages its fourth surge of COVID-19, there is one group that's still seeing patients of past waves. UT Health Austin's post-COVID-19 program is studying long-term effects of the virus, and they say they are currently still seeing patients who experience previous variants like Delta, but expect Omicron patients in about 3 months. KXAN's Tahara Rahman reports what symptoms they're finding.
I think the worst thing was my bones hurt.
It's one of many symptoms Jenny Lorraine feels nearly 2 years after contracting COVID-19.
Still get short of breath. I still haven't gotten my strength back.
Dr. W. Michael Brode says symptoms that last more than 4 weeks are considered long COVID. So far, they've seen about 140 patients at UT Health Austin's post-COVID-19 program.
But we're really seeing it comes in 3 different groups.
He says the first are patients who ended up in the hospital. Many now have heart damage and lung scarring.
There's a group that just has kind of persistent symptoms, usually cough, shortness of breath, and fatigue that just lasts a while.
Through skin biopsies, they found that the third group of long COVID patients either have fewer nerves or direct nerve damage,
Which we think is leading to the problems of the tingling and numbness and their inability to regulate sweating or their heart rate, because that's what those nerves regulate.
Dr. Brode says these folks are usually young and healthy and more likely to be women. Lorraine says getting tests and recovery resources through the post-COVID-19 program has helped her.
If somebody thinks they are still sick after they've gone through COVID, don't be afraid to ask your doctor.
Tahira Rahman, KXAN News.
Dr. Brody says there is some good news. If you have lost your sense of taste or smell, that is likely to come back within 1 year. He also says their tests don't show damage to the lungs or the heart for COVID patients who did not get sick enough to go to the hospital. He said that means there's likely not any permanent damage to those organs. One local physical therapy company says they're seeing a change in their patients with long-term symptoms related to COVID-19. Ben Morgan with Texas Physical Therapy Specialists says after the last surge, they saw patients who had trouble with fatigue. Now about 5 to 10% of their patients have had COVID. Also, his team is seeing more patients with lower back pain and muscle aches instead of respiratory and endurance problems.
My body hurts, my muscles hurt, not just the joints that we think of with the flu, but also with the muscles. So we're having some more treatments around helping people deal through that.
Morgan advises that if you have severe lower back pain, you should see your primary care doctor. If you have persistent low to moderate symptoms, you may want to see a physical therapist.